Hi, my name is Holley Farley, and I'm the coordinator for nursing quality here at Johns Hopkins Hospital.
Hi, I'm Christy Richter. I'm a lead clinical nurse in the neonatal intensive care unit, and Holly and I have been working together on the Nursing Scholars Day work group. I am so excited to hear your presentation on problem identification using fishbone models. But to avoid any distractions during the presentation, I'm going to go ahead and turn my microphone, not my microphone, but I'm going to turn my video off and we can begin.
Sounds good. Thanks, Christy. I'm excited to be here too. Let's go ahead and get started. So by the end of this presentation, you'll be able to identify problems, state tools available to us to perform a root cause analysis, or RCA as we call it, and be able to conduct an RCA using the Fishbone tool. The first step in any project is really identifying that you have a problem that you need to fix.
Okay, so how do you know you have a problem? Are there resources already at Johns Hopkins Hospital that can help us identify a problem?
Well, the best thing to do is review your data. Always go back to the data. A lot of times we kind of have a hunch that maybe there is a problem, but to really know if it is a systemic problem or an anecdotal problem or just a one-off, we can look at the data. For example, if you think that your patient admissions are happening on your unit during change of shift, your argument would be better supported if you could capture the timing of all your patient admissions. Having that baseline data, in this case, how many of your admissions occur during the change of shift time period out of all your admissions, helps make a stronger argument that something needs to change in order to fix the problem. Baseline data can really help you measure if what you're working on is actually making a meaningful difference. Another source of identifying problems could be reported safety events, falls or CLABSI rates, for example, staff surveys like RN staff engagement, things like that, or other timestamps that maybe come from Epic chart reviews. If you have a problem in mind, and you need help figuring out how you can capture that data, you can definitely contact us at the CNI and we can help you identify if this data can be collected in an automatic way or rather than having to do manual chart diggings. So now that we know we have a problem by looking at that data, the next step would get to the root cause of that problem.
We hear RCA all the time, but what is a root cause analysis?
Good question, Christy. So the root cause analysis is a tool that can be used when determining how and why a patient safety incident has occurred. We often refer to it as the RCA, like you said, and it's really a good systematic approach for staff to learn from a patient safety incident and use this knowledge to improve patient care. The purpose of undertaking an RCA is to find out what happened, how it happened, why it happened, identify those lessons learned. And for our CUSP champions out there watching, this quick RCA process is described in that learning from defects tool that we often use with CUSP. It's important to note that root cause analysis focused really on system and process issues, not individual issues and individual performance.
So what do you mean by system processes?
Good question. There's a lot of evidence out there to support that humans, we're only human, we make mistakes. It's the nature of being human, unfortunately. And being in the hospital healthcare system, it's a high reliable organization. And we must work to make improvements at the system level and the processes in which we deliver care to make it mistake proof and really improve outcomes. So here is a fishbone model. And they're an effective tool to use during a root cause analysis. They are helpful in determining all the possible contributing factors related to a patient safety incident or problem. And they provide a logical approach to identifying contributory factors to that problem.
I see from the graphic that it looks like a fishbone. That's a catchy way for us to remember the name of this tool. How would you recommend using it in action?
Yeah, it's definitely a catchy name. And in the past, I've used it with the whole team, maybe in your room online nowadays. But each section in the model is labeled with a header of a contributing factor, kind of like a theme that I'll go over with momentarily. But each team member in the RCA group could write down potential causes of the problem or safety event, maybe on a Post-it note, and they can be arranged into themes using the headers that I'll be going over with. This really helps organize everybody's thoughts during brainstorming sessions and helps identify root causes of the problem. So it could look a little differently now that we're in virtual world, but having just a big whiteboard with Post-its that you can move around and talk through with each other is really helpful. So as I said, the fishbone diagram breaks down examples of each factor, which can help jog your memory as you're completing the fishbone diagram. Here's an example of fishbone headers, breaking it down into these categories to help you square away possible root causes of the problem at hand.
Do you have to stick with these specific headers?
Good question. There are many different types of headers. I wanted to share this systematic and inclusive list from a helpful article that I read describing the process. I do have the article referenced at the end of this presentation if you want to go into further detail for those watching.
Can you think of a patient safety problem that you would like to share as we work through these factors? We can use it as an example of how to go through each of these factors, which might help.
Sure, that's a good idea, Christy. Thank you. So I can share with you a medication error of mine. Long story short, I scanned the medication that I was giving to my patient, but did not confirm after scanning with the computer screen to close out any possible alerts that may have been there. After giving the medication to my patient, I looked at the computer screen, saw an error message that I had scanned too many of the dose of that medication. So I ended up giving the patient double the dose, which was scary. Of course, everything turned out okay. Luckily, we disclosed that error to the patient, spoke with the team, the doctor, pharmacist, and then I immediately was eager to share my mistake with my coworkers on the unit because can happen to anyone. So really talking about errors is really great for culture of safety so we can all learn from it. But we'll talk through possible contributing factors to learn from this type of mistake and what that medication error would look like in this fishbone model. So one of the first themes is patient factors. That could include their medical history, history of present illness, any social, psychological, or relational, interpersonal issues that might be going on with the patient at that time.
In our medication error example, what are the patient factors?
So perhaps the patient required a non-standard dose of the medication or didn't know their usual dose that they were taking, or the prescribed dose that they were supposed to be getting to be able to stop the nurse from giving too much of that dose. So that could be an example for this case. So another theme would be the individual or staff factors. Some things to consider: what was going on with the staff member that day? Were they tired or distracted? For us in nursing, is it day 1 of 3 or day 3 of 3? And how does that impact how the staff member works? These are all things to consider. Task factors could include procedures or protocols, any decision aids that we might have, or even the design of the task at hand. Our policy here at this organization is to scan and then give the medication, not give the medication, then check your computer. So that could definitely be a major contributing factor to this patient safety event that we're talking about, just the scanning and alert and not closing out anything on the computer during the time of medication administration.
Communication factors seem pretty straightforward.
Yes, and often, unfortunately, communication factors do contribute to many errors or problems in healthcare. In this case, the electronic medication order could be something to consider, but yeah, we do see communication factors a lot and communication breakdowns. Similarly, team and social factors to consider listed here could be roles or leadership support. If you're solving a problem such as the initial thing we were discussing, admissions that change a shift, are there extra hands on deck during that time frame that are not getting report, perhaps like a standing 3 to 11 shift that covers that 7 to 7 time frame that could be able to help with the admissions during the change of shift time. So just other factors to consider that would fit under that theme. So when looking at a problem, there are education and training factors such as competence and supervision. For another medication example, on hire, we do take the insulin pen competency before we're using insulin pens. So before being able to administer that medication. So that's an example of education and training that could contribute to a problem. Maybe if that medication error that I, check my competency records just to verify that competencies were completed.
Equipment and resources. What kinds of questions would you ask to prompt the team to come up with potential contributing factors in this category?
For equipment and resources, in my medication error example, you could ask, was the scanner broken? Was Epic even loaded and on? Was the computer at the bedside working? These questions to ask could help get to the bottom of the problem. Even like, there's no audio with Epic, so if I'm busy doing medication administration, scanning, and then moving right along, there was no like ding or alert that I could hear to alert me that something was not right with the computer. So similarly, working conditions to consider would be staffing, environment, workload. Did any of these factors contribute to the patient safety event or problem being discussed during the RCA? So the last group of factors we'll cover is organizational or strategic factors.
Okay, I'm getting the hang of this. So I could ask questions such as, is there a policy in place for medication administration? What is the safety culture of the unit? And what is the policy followed regularly?
Yes, Chrissy, those are all great questions to ask to uncover system level factors and even unit culture factors that might contribute to the problem. So awesome questions and all things that you can ask when doing an RCA. Thank you for that. So all of these contributory factors lead up to your problem, which is that box on the right-hand side of your fishbone diagram. And with this fishbone diagram, you hope to find the answers to your questions of why the patient safety event or problem occurred.
So you have the problem and all of the factors that may have caused it. Now what?
Well, once you have the answers, you can work with your team to decide how you can prevent this patient safety event from happening again or how to reduce this problem from happening again. A great next step is to do an EBP project using our Johns Hopkins Nursing EBP model to complete a PICO question. We have Appendix B question development tool to help with that, and they are linked here on this slide. And you can go to the literature to find evidence-based solutions to your problems. Then once you have good answers from the evidence, you can move forth with a quality improvement project to make improvements. You can utilize a PDSA framework, Plan, Do, Study, Act. We have a great template for that on our CNI website as well. And then monitor outcomes, the ones we discussed at the beginning of this talk, your baseline data that supported the fact that you had a problem.
I love how you added the links so that we can go in and we can use these projects later. We can use these resources, and it's all come full circle. Thanks so much for sharing this interesting topic. You're the best.
No problem. Thanks for having me, Christy. The next slide here has a reference if you want to learn more about this framework, and then be sure to head back to our CNI website for more Nursing Scholars Program content. Bye-bye.